I'm Scott Pohl from WKAR News. This is Dr. Lisa DeStefano, and we're here to give you an example of what manipulative therapy looks like. Dr. DeStefano, thank you. What are we going to do here?
Well, I'm going to start by looking at you. I'm going to do some functional tests, which will help me to determine where I begin to treat. And then we'll just go from that right to the table.
All right, let's start. Here's the microphone. Okay.
So I'm going to spin you around. I'm going to start by looking at how your pelvis and sacrum move through space. So I'm going to lift your shirt up.
Okay.
I'm going to have to get my hand onto the back of your pelvis. I'm going to ask you to go ahead and bend forward just a little bit for me. And rise back up again. And then I'm going to have you put a hand on that right hand. I'm going to have you just balance yourself on the wall. And then go bring your right knee up to the ceiling. And then back down. Good. And I'm going to do the same thing. Bring your left knee up to the ceiling. And go ahead and put that right back down. Good. So that test makes me wonder if there's not something going on the right side of your pelvis and your hips. So I'm going to have you go ahead and sit here, face the wall, feet on the floor. This is another functional test, which is more specific for your sacroiliac joint. Go ahead and bend forward at the waist again, and come back up. And again, that confirms that right side. So I'm going to have you lie on your back with your head up here. We're going to start by looking at the right side of symmetry now of your pelvis. So I'm going to put my hands on your hips. And look at symmetry. The pelvis, look at symmetry. And I'm going to walk right down. And look at the front of your pelvis. And look at symmetry again. Now that just tells me where the asymmetry is, and I'm going to then treat the pelvis to restore its symmetry and its function. The way I'm going to do that is I'm going to monitor with my left hand the back side of your pelvis. I'm going to position your knee and your leg so that I can get the best advantage of muscle force to help me with the manipulation. And then I'm going to ask you to gently press this knee gently towards the foot of the bed. And you're going to and I'm going to resist. And relax. And I'm going to take up a little bit of the barrier. Go ahead and press again. And relax. And press again. And relax. That's a technique called muscle energy. It's a commonly employed manual technique. So I'm going to go back down. I'm going to look at my landmarks. Look at the front of your pelvis again. Pubic symphysis, ilia, and assure myself that I have squared your pelvis up. Good. Now I'm going to have you go ahead and sit up again. Your legs right over the side. Slide forward so your toes touch. Now I'm going to go back to my functional test and then determine where to go next. Go ahead and bend forward at the waist. And rise back up. Okay. And then I'm going to have you. Now I would put you on your stomach. So we're going to take your glasses off and set them up here. And then I'm going to give you a place to push your face. I'm going to ask you to lie on your stomach. Now I need to look at the symmetry of your sacrum, which is the bone that sits between the two hip bones, the bottom of your spine, and above your coccyx, or your tailbone. I'm going to look at it at its lower aspect and at its upper aspect. And I'm going to have you rise up onto your elbows as if you were watching TV. Good. And I'm going to look at its motion and its static position as you come up into this backward bent position. And that helps me to determine the dysfunction and the asymmetry of your sacrum. Its lateral, its side, and exactly where I need to place you. So now I'm going to ask you to lie into your left side, facing that wall. Just raise the table up.
So is this diagnostic that you're doing here, trying to
Diagnostic.
determine what
Yes.
might be at fault in
Exactly.
if I was having some pain?
Correct.
Okay,
And I diagnose, and then I treat. I diagnose and treat.
okay,
Yeah, I never go right to treatment because what you have today may be different than what you will have in 6 to 8 weeks.
sure.
Go ahead and slide your hips out towards me. And I'm going to monitor your back right at the bottom of your spine. Bring your knees forward just to set your sacrum into a place of ease. I'm going to just space your knees apart. I'm going to roll you back so that I'm taking these joints into their initial areas of restriction. I'm going to have you pull your shoulder into my elbow gently. Just gentle. And just hold, 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 hold. And relax. I'm going to roll you back a little further. Pull your shoulder into me again. And relax. And pull your shoulder into me again. And relax. So we start with the lowest lumbar. And I'm going to just take this shoulder and pull it out just a little bit. I'm going to monitor the bottom of your spine again. Now we're going to treat that sacroiliac joint on the right side. I'm going to use your leg as my lever. I ask you to lift this leg straight up to the ceiling gently. Perfect. And just hold, hold, hold. Good. And relax. Take it to the next. Go ahead and lift again. And relax. And lift again. So you're using muscles. And relax to move the joint. Again, a muscle energy technique. Go ahead and lift. And relax. Good. And I'm going to continue to do that until you have freedom of motion of that joint, which I feel under my hand. It's all palpatory. All right. Now I'm going to have you go ahead and sit up again. I'm going to lower the table. I'm going to have you slide up. And again, we're going to reassess. Go ahead and bend forward at the waist. Come back up. All right. Now I'm going to sit you real tall. Real tall. There we go. Good, good, good. And then relax your shoulders. Stay up tall. You feel your butt bones? You know where the sit bone is?
Mm-hmm.
A sit bone is the portion of your hip that you sit on. It was made for us to sit upon. Now, my goal for you is that you use them.
Oh, I sit plenty.
Yes.
Maybe not properly, though.
Yes. So most people sit. Go ahead and sit comfortably. As you sit back, most people sit on the bottom of their spine, on the coccyx or the sacrum. And that's not the way we were intended to sit. We're best seated, so we do have an arch of our back. Our back is not meant to be flat. We're meant to sit on those butt bones. So holding ourselves, our feet are to be flat on the floor. So that's where I would begin an instructional conversation with you about posture and placement, so that when you do sit or walk and stand, your body's muscles are actually holding itself and stabilizing itself. Otherwise, we put too much force in the joints, and that's when they become loose and then arthritic.
I have started standing at work, and so I'm on my feet much more than I used to be as a radio reporter. I have found that to be helpful, and if nothing else, it reminds me to walk away from the desk once in a while and take a lap around the office, that kind of thing. Is standing something that you're seeing more of? Is that beneficial as opposed to sitting at a desk all day?
Yes, very much beneficial. If in particular, standing will, if we stand using correct muscles and in the right position, then we burn more calories, we strengthen our spine, we have to exercise less. We have less muscle spasms, in particular in the hip muscles and in the back muscles.
So if I were a patient, would this be the point where you would begin to give me some guidance about how to sit, how to walk, how to stand?
What to do, what not to do, correct.
All right.
Based on what I'm finding.
Dr. Lisa DeStefano from the MSU College of Osteopathic Medicine. Thank you.
You're very welcome. My pleasure.
For WKAR News, I'm Scott Pohl.